Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
all of the following drugs are useful for long term for congestive heart failure except dobutamine is not used for long term. Actually, dobutamine is only indicated in acute treatment of decompensated heart failure. It is only used in the acute treatment of decompensated heart failure. Which of the following drugs are beneficial in refractory congestive heart failure by increasing the cardiac contractility and decreasing the preload of the heart? Actually, ambrinon will increase the cardiac contractility and decrease the preload of the heart. How? Because ambrinon. Oh, I'm sorry, I didn't see this properly. Ambrinon. What does ambrinon do? Ambrinon is a phosphodiesterase inhibitor and it also acts as an inotropic indicator. So because it is an phosphodiesterase inhibitor, it causes vasodilation and thus it decreases preload and it also decreases afterload. Whereas because it is an inotropic agent, it increases cardiac contractility. Next, which of the following statements
thank you and thank you for watching.